right? It
Yeah.
doesn't happen overnight.
So how successful is your program at helping patients?
Great
What do
question.
you see?
Like for example, our programs are 3 and 6 months long, usually. Okay. So for anybody who understands bone density testing and bone density results, you're not going to see improvements in a bone density scan in a 3 month or 6 month period. And that's why bone density scans are done every 1.5, 2 years down the road, because otherwise you're within that margin of error of a bone density scan. So your improvements are not going to be statistically significant at that point. But what you can do is look at those bone turnover markers. You can look at the activity level of cells that are building up and breaking down bone, and you can start to get an idea of what the potential outcome can be in the future. And if you're addressing all of the leading indicators that give you the best shot of improvement, the diet, digestion, absorption, root causes, sleep, stress, hormones, exercise, all those things, those are your leading indicators. If you go through and address all those things, you don't miss things. Your lagging indicator, which is a DEXA scan, has a much, much better shot at being favorable for you in the future. And we've had people, our program, as of the time of this podcast recording, but it'll be longer than that for whoever's listening to it, has been running over 2 years now in its current format. And we've had plenty of people come back with having improved their bone density, improving their bone strength, stabilized their bone loss. That's huge. Even if you're not improving, if you could stabilize and not lose more, that's great. It's really, really great. So, and then also if somebody's fracturing when they come to us, preventing additional fracture and injury, those are all huge wins for us. So
are there anything immediately someone can do to enhance their bone health? Any supplements? And I know healthy anti-inflammatory diet probably is really important. And then, do some exercise, both strength and impact training. Any other things that you recommend to people frequently?
Anti-inflammatory diet is super important. Some specific foods that could go really well in there. One of my favorites is actually arugula. I'm not sure if, a lot of people eat a lot of spinach, and I don't like vilifying, specific foods, because I think you can still eat and consume these foods, but arugula it's a leafy green, same cruciferous family of vegetables as broccoli and kale, great source of potassium, folate, vitamin K, vitamin C, and bioavailable calcium. So if you've got up 3 ounces or 85 grams of arugula, which can actually, if you're sauteing it lightly, it kind of gets to a small portion on your plate. That's got about 200 milligrams of bioavailable calcium, which is fantastic. That's plant calcium. But the reason why I mentioned spinach is, unlike spinach, which is a common green a lot of people use, arugula is low in oxalates. And oxalates are an anti-nutrient that can bind up bone healthy minerals like calcium and prevent their absorption. And if you've got digestive issues or kidney stones or arthritis or joint pain, those may be some indicators. You may have a hard time breaking down and degrading that oxalate. So you can swap that spinach, right, for arugula. That could be a good swap. And then I love vitamin C rich foods also. Vitamin C is, I think most people know vitamin C has a lot of health benefits to it by now. Helps blood pressure, heart disease risk, gout, iron deficiency, memory, cognition. But for bones specifically, vitamin C is helping form blood vessels, cartilage, muscle, and even collagen in bones. So it's super, super important. If you remember, bones are made up of this collagen protein matrix upon which minerals are laid. So what vitamin C is doing is it's stimulating procollagen, it's enhancing collagen synthesis, and it's stimulating alkaline phosphatase activity, which is a marker for osteoblast bone building cell formation, which is pretty freaking cool. So that's really neat. And you can find vitamin C in, citrus fruits and berries and Kakadu plums and acerola cherries. And, there are plenty of sources of vitamin C rich foods, but then also vitamin C rich vegetables too. So those are just a couple ones that I really like, and they're easy additions to make too. There are plenty more, plenty more things on the list there to add. It's not just eat arugula and vitamin C rich foods. There are plenty of other things to include, especially protein. Protein is so important for your bones. Your bones, they're 50% protein by volume. So you need, a constant supply of amino acids for